to take care of the patient. That means that we either are forced to stay afterwards, they call us in on our days off, somebody has to be there. And I collected all the text messages that the hospital sends out over the past year. I have 25 pages, which is hundreds of texts I've received almost every day to get help to come in on my days off, I'm on vacation, whatever they ask me to come in. So
average of 10 per page.
That's just my personal text messages that I received from the med-surg tele department. So everyone on the med-surg got all these texts. So I've done the research and kept all of the texts just to prove they need help. We need help staffing. And I just wanted, and every month I go to a labor management meeting and they tell us the amount of times that an admission nurse and a clinical resource nurse were not in their role because they're either taking a patient assignment or there's a sick call or something. For example, the month of August, there's 24 shifts out of the month, 24 out of 31 that an admission nurse had to take an assignment or was not in their admission role. So they're just taking wherever they can to fill in these holes, which leaves the nurse on the floor not having any resource. It takes about an hour to admit a patient. We need that admission nurse. We need clinical resource nurses to come help us when we're drowning and we need to take a break. They cover our breaks, they help us start IVs. We need that person in the role. And there's always excuses why they're not in that role. Well, somebody called out sick, so we're in a crisis. It's an emergency. That shouldn't be the case. I just wanted to bring up the ad that Cindy Russo put in the paper, how she mentioned that we are a part of the top 100 rural communities, which we should be proud of. We're one of the top 100. But what does that really mean? Myself and Robin Knife, we both contacted the hospital strength index, the agency that gives us that number, and I have them over here. You can take a look at it afterwards. But to sum it all up, we score a total of 88.3%, which puts us in the top 100. But if you look at the quality, outcomes, and patient perspective, those are really low. Out of 100% for quality, we score 9.4. For the value, so for the patient outcomes, out of 100%, we score 38.8. And for patient perspective, out of 100%, we score 14.3. The other numbers that are 90% and 80%, those are for the market, the inpatient, outpatient. Yeah, we're getting money. People are coming into the hospital. We're getting money, but the value is what is key that they're not telling us. Like they're skewing, like Donna was saying, they throw all these numbers out and it makes it look great, but really the value and quality patient care is what should be important. If we make that better, the hospital will get reimbursed for patient satisfaction and the surveys will be increased and they're still going to make money.
So we get, for market share, we have, and this is for the August 2017 figures, we have 92% of market share for inpatient and for outpatient. We're the only hospital in town. Of course we do.
And Cindy Russo's ad also mentioned that when we have the Joint Commission, they gave us excellent results. Well, they don't tell you that we're overstaffed those days that the Joint Commission comes in. Yeah, of course it's going to look great. Management is out there on the floor. We have CNAs doing housekeeping. Everything's nice and tidy. We have extra staff for those days to make it look pretty when Joint Commission comes in. I'm glad that we get excellent readings, but... They also hire a consultant working for a month on the Joint Commission, preparing us for when they come in. Why can't we look good and have quality care 24/7, 100, or all the days of the year? Why not just Joint Commission days? Hold on, let me finish. And then she mentioned how we have a plus bond rating for the leapfrog results, which they don't mention some of the, there's three groups over here that they don't mention in particular that we're really poor on, that we need to improve, is infection rates and injuries. There's like, you guys can check this out afterwards, but there's one line out of 4, we're in the lowest part, and for inpatient care management, like preventing blood clots and maternity, we have 2 lines. That's worse than our target. So, in the general picture, yes, we're good on some things, but there's a lot of areas that are really important that we need to improve. Quality patient care, the value of our hospital needs to be improved. And she also mentioned that there's no evidence that showing the limit of how many patients a nurse can take care of. She said that there's no evidence. Well, that Donna had mentioned, that's a straight up lie. We have a whole book full of evidence-based practice about the limitations. And we have 2 articles over here that you can check out after that show readmission rates increase when you don't have the amount of nurses taking care of patients. And patient pain control, that decreases when you don't have the amount of nurses to care for the patients.